Good morning. We're gathered here on Treaty 6 territory, and I acknowledge the Métis people who share a deep connection with this land. I'm Peggy Wright, the Alberta NDP MLA for Edmonton-Beverly-Clareview and the Critic for Labour. I'm joined by my colleague David Shepherd and by many leaders and frontline professionals from Alberta's health workforce. Too many to name, but you will hear from them very shortly. Thank you all for being here. All of these Albertans are here to say no to Danielle Smith's plan to concentrate control of the healthcare system in the Premier's office and cause catastrophic chaos in our hospitals, clinics, and seniors' homes. The UCP is going to actively drive away frontline workers as they impose the chaos of 13 new agencies, boards, councils, centres, and secretariats. That's even before they get into the mass privatization plans that we saw clearly described in the cabinet presentation from yesterday. Albertans do not trust the UCP on healthcare, and with good reason. The radical disruption we saw described this morning is not an attempt to make Albertans healthier or to give those Albertans a better place to work. It's a power grab, plain and simple. But the results for patients and for healthcare workers will be more UCP chaos. We have a lot of folks here today, so I'll get right to it, and I will invite up our first speaker, Gil McGowan, President of the Alberta Federation of Labour. Gil.
Thanks very much, Peggy. As Peggy said, my name is Gil McGowan, and I have the honor and privilege of acting as the elected president for the Alberta Federation of Labour, representing 175,000 workers in this province. Fully 1/3 of our membership works in healthcare. The vast majority of those are employed by AHS, and they will obviously be dramatically impacted by the plan that has been announced by the government today. We are here today because we are deeply troubled by the government's plan to reorganize healthcare in Alberta. To put it bluntly, this is a plan to eviscerate our public healthcare system. It's an attack dressed up as a cure. To be clear, healthcare workers in Alberta believe that things are not working in our healthcare system. In fact, frontline workers have been raising the alarm, literally for years. And as we gather today, the system is literally in the midst of a collapse, with multiple hospitals at more than 100% capacity and patients sometimes having to wait 19 hours or more to be seen. Things are bad, and we do need change. But this most certainly is not the change that we need. In fact, frontline healthcare workers are here today to say that this plan will make things worse, much worse, rather than better. We say this for 4 reasons. First, this plan does not provide the support and resources that are necessary. Instead, it will create chaos in our healthcare system at the worst possible time. Second, it is clear that this government has introduced this plan to create a platform for privatization. Third, despite the government's rhetoric about decentralization, this plan is clearly about taking control away from healthcare professionals and putting it in the hands of politicians, especially the Premier and members of her cabinet. We are convinced that this is about making sure that there will never again be a province-wide approach to public health care. Fourth and finally, we are distressed by this plan because it does literally nothing to address the real problem that is plaguing our healthcare system, and that is the problem of chronic worker shortages. Last night, John Meddings, the former Dean of the Faculty of Medicine at the University of Calgary, said that Alberta has among the fewest doctors per capita and the fewest hospital beds per capita among all OEC jurisdictions. That is the problem that is driving the long waiting lists. That is the problem that is undermining the quality of care in our system. And nothing that was announced by the government today addresses those fundamental problems of chronic underfunding and staff shortages. This plan will not address the problem that it purports to address. Instead, it will create jobs for bureaucrats, but it will not add a single frontline worker. In conclusion, Our Premier, Danielle Smith, and our Health Minister, Angela Grange, said this morning that this plan has the support of stakeholders. We are here to say that that is most certainly not the case. Healthcare workers are the most important stakeholder in the system. They keep it running every day, but they were not consulted and they do not support this plan. Now let's hear from some of those workers. We are joined this morning by Annie Johnson, who is a frontline RN in the system. We'll hear from her first, but we're also going to hear from Rory Gill from QP Alberta and Raj Uppal, who represents support workers in the Edmonton healthcare system. We're also going to hear from Dave Baraniak, who represents workers in long-term care, and he's joined by his colleague Tanya Lemke. And last, we're going to hear from Karen Capri, who is the Secretary-Treasurer of the Alberta Federation of Labour, but also an RN with 30 years of experience in the system. So with that, I'm going to turn it over to Anna Yee.
Thank you, Gil. My name is Anna Johnson. My pronouns are she, her, and I respectfully acknowledge that I am on Treaty 6 territory and Métis Nation of Alberta Region 4. I'm a registered nurse here in Edmonton. Our public health care system used to be run at an arm's length from the government. This was a recognition that the health of our loved ones is best served by expert and objective decision-making. Unfortunately, Danielle Smith and the UCP want to bring our public health care from an arm's length into their own back pockets. This will not serve Albertans. It will create layers of bureaucracy, funnel public funds away from patient care, create greater systemic inequity, and put our entire public health at risk. I work in public health care system because I want to provide a service that by and large can be accessed by everyone. Health care is not a commodity to be sold to the highest bidder. It is a public service. It should be accessed based on need, not on the ability to pay. This is part of the very fabric of a caring society. Minister LaGrange, as Gil said that frontline workers will be consulted and listened to. Why wasn't this consultation made before the decision to completely overhaul and sell off our public health care system? No healthcare worker I know would recommend that millions of dollars be spent on additional layers of bureaucracy and to eliminate public delivery of services, compromising the care of all Albertans. We need better staffing, which requires respect for healthcare workers. It requires initiatives to retain, recruit, and return healthcare professionals to the public healthcare system. We need to address the social determinants of health, including issues with housing and wealth disparity. We have seen what happens when aspects of our healthcare are turned over to private providers. Our seniors have been left out of the public healthcare umbrella in private continuing care facilities. This led to decreased transparency and accountability with disastrous results for the people in care. Instead of money being spent on excellence in training, appropriate staffing levels, good wages and benefits, and stable full-time positions, money went to out-of-province and out-of-country shareholders. Our communities suffered, our workers suffered, and our seniors suffered. The UCP hopes to expand this failed model to almost all other aspects of our public health care. As a frontline worker who spends my time advocating for safe patient care and safe working conditions, I speak vehemently against this public health care sellout. Thank you.
Hello, my name is Raj Uppal. I am president for QP Local 41 in active treatment and continuing care.
Hi, and my name is Rory Gill, and I'm president of QP Alberta. Back in August, I met with Premier Smith, and she made a commitment to me and my colleagues that this government would consult with workers in healthcare and the other sectors where CUPE represents folks. And I'm sad to say that this promise has been broken because the thousands and thousands of CUPE members who work in healthcare have not been consulted at all about this plan. And I know that because not one of them would have recommended this complicated and expensive reorganization plan. What we are facing up to is further chaos after unprecedented crises in the healthcare system. This government wants to add complication, they want to add confusion, and they want to spend $85 million changing how we deliver healthcare with no end in sight. We don't need to waste $1 on more bureaucracy and more reorganization. That money needs to go to frontline workers. It needs to go to support the people who have supported us tirelessly and without complaint for so many years now. It's time that we honor the folks in public health care, give them the resources they need, listen to them, and reform the system based on their recommendations, not the recommendations of this government, which is focused on cheapening our public health care, privatizing it, and making it tougher to get well in Alberta. And Raj can talk about what she sees on the front lines.
Absolutely, and we have seen the government done lots of reviews and consultation by using taxpayers' billions of dollars to assess where healthcare is and where it should go, and all that has done is slashed our healthcare workers at knees to provide the care that they ought to be doing on the floors. And also, it's caused nothing but chaos of layoffs and staffing shortages in adding into the pandemic that we've gone through. And also, there were few good things that came out of some of the reviews that were done. Of course, those were the only few things that were not implemented. And some of that such would be care hours for our seniors. Yet, the government is to put that in place so that we can actually fix the healthcare system. But instead, we're seeing this more reorganization of higher powers to be, where nothing else will happen other than our more healthcare dollars will be lost to the powers to be instead of on the floor. And there's no promises that we have heard from the plan that was speaking to building more hospitals, creating more beds, creating that staffing, fixing solutions for, and providing solutions for staffing shortages. There was none of that, and that's very shameful. So none of the healthcare workers, I would say, support this plan that has been put out by UCP this morning.
Good morning. I'm Dave Bernick. I'm the President of the United Steelworkers, Local 1207. We represent 1,500 hard-working Albertans in the long-term care sector. I echo the earlier comments of my friends, and this is a recipe for chaos at a time when our members are desperate for stability and investment. Our members are chronically short-staffed and severely underpaid. It will do nothing to address the actual issue like dangerously low staff. We were not consulted on this plan, and we do not support it. It's going to add a lot of chaos to the system, as we've said, and it's not very good. Thanks.
Good morning. My name's Karen Caprice. I am the Secretary-Treasurer for the Alberta Federation of Labour, and as Gil mentioned, I'm also a proud registered nurse, and I've worked in the system for nearly 3 decades. I've devoted my nursing career to working in the long-term care sector. It was the area I chose to work in right after nursing school in 1993, and sadly enough, it coincided with another government's effort to dismantle public health care. Our entire system suffered years of disruption and uncertainty following the savage cuts made by the Klein government. Thousands of healthcare workers were let go. We worked in a system that continually demanded more with less, and as we faced ever-increasing acuity. So fast forward to 2023, and now we have a healthcare system that is again under immense pressure, but this time Danielle Smith's government is proposing the radical changes. Collectively, healthcare workers have worked through the worst periods of the pandemic. We've faced working conditions unlike anything we've ever experienced. This has left many healthcare workers exhausted and disillusioned. Currently, we are facing a worldwide staff shortage, placing even greater stress on an already beleaguered workforce. In Canada, 4 out of 10 nurses are contemplating leaving the profession. According to CIHI, Canadian nurses had an increase of 50% in the amount of overtime they worked, and this brings the total of overtime hours to a staggering 14 million hours. We must never forget that simply increasing beds does not mean that there will be staff there to care for those in need. We've seen how privatization has failed our communities. Private care facilities had worse fatality rates during the peak of the pandemic. The disastrous consequences of the failed experiment to privatize laboratory services is another cautionary tale. When profits are deemed more important than people, care suffers. Clearly, the plans we have seen today serve as a platform for further privatization. We know that our working conditions are patient/client care conditions. We do not need this type of reorganization in the system. We've done this multiple times. It creates uncertainty and instability. A renewed attempt will not solve the core issues facing the healthcare system. I want to make mention of long-term care in particular. Often, this is a field of work not given the respect it deserves, and by extension, those clients who require this care. It is important that long-term care is an integrated part of the healthcare system versus being siloed. Long-term care should not be looked at as an easy target for privatization. The government must not abdicate their responsibility to ensure publicly funded and publicly delivered, affordable, accessible, and quality care. We need clarity, certainty, and improved collective agreements in order to attract and retain the healthcare workers that Alberta so desperately needs. Thank you.
Well, thank you to everyone who has come to speak today on behalf of healthcare workers in the province of Alberta and to share their perspectives. We believe healthcare does need reform, but through investment in the front lines, a massive recruitment and retention campaign. But this, Danielle Smith's plan to concentrate more power over healthcare in the Premier's office, well, this is going to cause chaos in our clinics and hospitals. I encourage Albertans to take a look at the government's own analysis of the risks of their own plan. The slides we released yesterday, where it talks about fragmentation of care, service disruption and or failure. These are extraordinary risks. We didn't hear a word from the Premier, from the UCP about them this morning. What Danielle Smith described this morning will make healthcare slower, harder to find, and more fragmented and siloed. It means inferior healthcare for Albertans. And I and everyone here today believe that is unacceptable. Thank you, and we're happy to take any questions.
Thank you, and I'll start with questions in the room. See someone approaching. You could say your name and your outlet at the top.
Hello, thank you. Morgan with Global Edmonton. A question for those working on the front lines of healthcare. The province did say it's going to start consultation with AHS workers tomorrow. I'm wondering what you're going to tell them when they begin that engagement.
Hi, Anna Johnson, she, her. Thank you for the question. The fact of the matter is the consultation should have taken place before any plans were made. It's part of smart planning is to do the consultation ahead of time before you come up with the plans. Now we would tell them the same things I said, which is you need to respect healthcare workers, which includes listening to them, acting on their advice. It includes campaigns to recruit, retain, and return healthcare professionals to public health care. And ultimately, it would mean strengthening our public healthcare system as a whole, not selling off parts of it, leaving people behind. Thank you.
And I think for you, Mr. Shepherd, what do you foresee happening when, there's the 4 organizations, but when care overlaps, like with mental health and addictions and acute care? What challenges or opportunities exist within that healthcare goes into so many different things.
Certainly, that's one of the concerns, and indeed that was identified as one of the risks of this plan by the public service, that fragmentation of care. And I can tell you already, it's already a challenge across government ministries, right? When you have these issues that overlap, something like mental health that also touches into housing, it touches into child services, touches into healthcare. And we have already seen in the past there are real challenges getting coordination on that. There have been massive efforts made to try to bring those things together and have people at the same table. What we see here with Danielle Smith and the UCP is now they want to do exactly the opposite in the midst of the healthcare system. So we're going to have these separate silos, we're going to have separate coordination, we're going to have different boards and agencies and everyone that's involved. And ultimately what that's going to mean is the degradation of care, particularly when the government is consolidating more of this power in the Premier's office and under the Minister of Health, which is away from the front lines and directly against what she has promised to Albertans, that she would be supporting more local empowerment and decision-making. So we are deeply concerned that when, at a time when we already see its considerable degradation of care, in part, good part, due to the neglect and I think willful ignorance of this government on so many fronts, that this attempt at reorganization and additional bureaucracy is going to make that even worse.
Hi, Emmanuel Prince from Radio-Canada, for Mr. Shepherd. What do you think about the ideas of having 12 regional boards and an Indigenous board that's going to spread the whole province? Do you think it's going to help to deliver better care in like rural communities?
So certainly we support hearing more voices at the table and having local communities be able to speak. I mean, let's be clear, we have an Indigenous body within Alberta Health Services. And what happened within this past year is Danielle Smith and her government directly interfered in their ability to make the decisions they wanted to make for the best care for their community. They reached in and told them who they could and could not hire. So I do not see this being a government that in any way has demonstrated they are willing to support local communities to make decisions if they do not like what those decisions are. So what we see here is, yes, they're going to create more bureaucracy, they're going to create these more regional boards, but they're ultimately going to consolidate all of the power in the office of the health minister and the premier, a premier who has demonstrated she has a pretty poor understanding of where legal boundaries lie, and indeed where her expertise lies. So we are deeply concerned that even with a veneer of more consultation or of more, I guess, more folks at the table, that ultimately this is just more power in the hands of the premier.
Follow-up for any healthcare workers who wants to talk about this, but essentially the government argues that AHS has become too big, unmanageable. Do you feel in your work daily that AHS is too far removed from the hospital floors? Someone?
Hi, thank you for the question. I don't feel that AHS as a whole is too big. I think when they integrated the healthcare systems, it was keeping in mind that we wanted care to be equal for all Albertans. However, I do think they need to consult more on a regional basis. But this is not what this is about. The plan that the UCP has put forward today is to sell out the delivery of aspects of our healthcare system so that it will no longer be under the umbrella of public health care. They kept reiterating that it would be publicly funded. However, we've seen time and again when the public delivery is made private, it actually costs the system more money, and the money is not going to the right people. The money is not going to provide direct patient care. That money is then going into shareholders' pockets. So I don't think that what they've proposed today is an answer to any problems that we're facing right now.
I'll do a quick check for questions on the phone. Just a reminder to press *9 if you're joining us on the phone, raise hand function if you're joining us via Zoom. And seeing none, that's all for today. Thank you.